My name is Chisa Huffman, and I'm here to discuss today the importance of oral and denture care with the elderly. The importance of oral and denture care. Our teeth, both natural and artificial, if taken care of, could possibly last a lifetime. Unfortunately, there's natural, environmental, and other unforeseen substances that affect the integrity of our mouths on a daily basis. In addition, there's certain medications, disease processes, foods, drinks, everything that we consume on a daily basis that we add that increase the risk of additional breakdown. Proper and regular oral denture care helps to combat these effects. Our lifestyle choices, smoking, drinking, healthy diets, bad diets, and certain diseases can even potentially degrade one of our most important lines of defense, our oral cavity, our mouths. The protection provided from our teeth, our saliva, and the overall mouth, it keeps us healthy and it aids in many functions, including starting the digestive process. Now, did you know that not doing oral care daily could potentially cause an infection? It could irritate, it can cause tooth decay, bad breath, and it could even increase your risk for Alzheimer's disease. This is stated from Dr. Scanapieko from the Department of Oral Biology. Now that we know how important oral care is, let's talk about what to do. First and foremost, we should always try to brush a minimum of 2 times a day, both your natural and artificial teeth, okay? Keeping regular checkups with your dentist, eating a healthy diet rich in vegetables and fruits. Also, remember, we put more food in our mouths on a daily basis than anything, which increases our chances of a plethora of different infections. So oral health is very important. Now I'm here today with my grandmother, and we're going to do a demonstration on proper denture care. Hi, we're sitting here today with my grandmother, Burnell Godfrey. She's 86 years old.
87.
Oh, 87. Whoops, I missed a year. And she's had dentures since 2009. So I'm going to just ask her a couple questions about what she feels and thinks that denture care and oral care is all about. All right? So, Granny, how many times a day do you do denture care? Or do you wash your mouth out?
At least once a day, but it should be done more.
Ah, so you know it should be done more.
Mm-hmm.
So, what do
But
you...
I don't have time.
You don't have time, you're so busy, right? So, what things, how do you rinse your mouth out? What do you do? Do you use water, or do you use mouthwash?
I use mouthwash.
Yeah. So since you do have dentures, have you gotten any sores or anything in your mouth sometimes?
No.
No? Do you keep your dentures in all day?
All day and all night.
Okay. So you have both top and bottom?
The bottom ones don't stay in too good.
Yeah. What about foods and coffee and stuff? Have you noticed it staining your teeth or anything?
No.
No? Okay. Well, just a few questions, and just normal questions that we would ask on a daily basis to our elderly population. But now we're going to move to this table that I have right here. And these are just some of the basic things that you can use for denture care. So we're going to address, the things that Granny understands and the things that probably should be explained better. But first, we're just going to look at these few household items that you might have. So we have a little country crock, old bottle. And we have the lower plates in here. The best thing to do is to label this, because sometimes we forget that we put our stuff in here and it looks like an old little, butter thing, and you just want to throw it away. So the first thing I would advise Granny to do is just label her stuff, because it's so easy to just get fast-paced and just throw everything away. Although I'm not really thinking Granny is as fast-paced as we'd like. Right, Granny? You're not very super fast, are you?
No.
Okay. And then here, I have this little soft bristle brush. You can get these for free when you go out of town, if you go to a hotel, if wherever you stay. You can get these at the hospital when your loved ones are there or your friends or family. They're the cheap little easy, soft bristle brushes. They're disposable and they're like the best thing for dentures or even for just regular natural tooth care. And then we have these effervescents. It depends on your preference. You can use, a multitude. There's so many things out on the market. As long as you use something that does not degrade, erode, break down, make your normal teeth sensitive, your denture sensitive, or anything. So, we have to have some type of cleaning product that has some type of fluoride in it, okay? So now we're going to go back to answer some questions for Granny, okay? So Granny, you stated that you only clean your mouth out about 1 time a day, but it should be done more, right? Okay, so you're correct on that. So we should be providing mouth care about 2 or more times a day. So let's get to some denture care, okay, Granny? Let's get to some denture care.
Oh, okay.
Okay? So first we're going to handle them with care. We're going to take our soft bristle brush and at least 2 to 3 times a day, we're going to take our dentures. These have been soaking in this effervescent, this Efferdent, which is what you're supposed to do if you take them out of your mouth and you keep them out, okay? So what we do is we want to make sure that we brush exactly as we would brush our teeth, okay? You're going to stroke, and make sure to get in here too, because if you use that gel, it's going to get sticky and it's going to have buildup, okay? And that can also cause irritations in your mouth. It can cause buildup. It can cause bacteria, okay? So after we do all of that, we rinse it off. Then we put it back in our soaking and close it up, okay? We want to avoid the hard bristles, like I said again, because we don't want to break down, the teeth that we have or the artificial teeth that we have, okay? So I know I've said a whole bunch of things to you, Granny, and I've shown you a whole bunch of stuff. Is there anything that you learned today that you thought you were doing wrong, that you knew you were doing right?
Well, I know that I should be brushing more often.
Yeah. All right. So here we have just a brief summary of teaching the elderly and informing them more about oral care and how to take care of their dentures and their real teeth. Thank you.